uh, it's important that we don't backtrack from the basics, wearing masks, washing hands, keeping social distance, because we are not yet out of the woods. But I would want to say the countries that have invested in health, they have prioritized clean water, they have prioritized access to nutritional food of good standards, they have invested in housing, they have invested in social protection, are the countries that are thriving in the COVID period, because these are the things that people need to be able to survive during a pandemic. And because some of these things have not been made available, people have developed a level of fatigue because they need to address their socioeconomic needs and they need to be able to get out and to be able to do so. And so by the government not having a cushion for these issues, then that is what is causing a gap, because people need to go out and fend for themselves and they feel the lockdowns, the movements are restrictive on their day-to-day lives. Now, what is important, given that now we are getting into the theatrics of politics, would be to understand whoever is running to be the next head of state, what plan do they have to make some of these things an actual reality? Because COVID has exposed the inequalities that exist among us in this country, the inequalities in the health system, and any serious person who wants to lead this country should be telling us what is their plan to do so when they get into power. Because if we're going to make health services affordable, available, acceptable, and of good quality, then we must look at the right to health from a holistic perspective. It's not just about building hospitals and putting people on treatment. We should be thinking about how do we have less people visiting the hospital because they are living a healthy lifestyle, and what has I have a government, either at the national or county level, done for that to be able to happen. And just lastly, on what Professor Yogi said, that if we continue to go in this direction of not following rules, our health system is going to be overwhelmed, which is extremely true. But the counter question is, the ICU beds the counties were to put in place, the ICU beds the national government was to put into place, the funding they got from World Bank, from Global Fund, and then even other coffers, what exactly did they do? As I sit here as a civil society representative, we don't have a clear perspective that the investments that came in, did they actually strengthen the health system, or did they turn people into COVID-19 millionaires? I think that's a pertinent question that needs to be addressed, because if we can't use the COVID pandemic to strengthen the health system, and that not includes infrastructure but human resources for health, then we're not going to get out of the woods from any other.